My best wish to Associate Professor Dr. Janice Ngalai Hui. I am Muhammad Harsuhaimi bin Marun. My matriculation number BB221104111. And I will comment on the research I have conducted regarding a Malaysian politician following the issues and concern he expressed in the parliamentary session that took place on December 9, 2020, corresponding to Wednesday in the subject of development economics for the year 2023-2024. There are several components that I will comment on this study, including an introduction to the background of politician, a summary of official statement, evaluation and ranking, suggestion and the conclusion. Introduction. The Honorable Jalaluddin bin Alias is a Malaysian politician who has served as a senior member of the Negeri Sembilan State Executive Council (EXCO) in the Pakatan Harapan State Administration under Menteri Besar Aminuddin Harun since August 2023. A Member of Parliament for Jelebu since May 2018 and a Member of Negeri Sembilan State Legislative Assembly MLA for Petang from May 2013 to May 2018 and again since August 2023. Next is a summary of the official statement that Datuk Seri Jalaluddin raised in the parliamentary session. The first being the allocation for clinical support service. MP Jalaluddin highlight that the allocation for detail 0x0600 clinical support service was empty for the year 2021, despite a significant allocation of RM 137.29 million in 2020. Closure of One Malaysia clinics. The MP expressed his concern about the closure of One Malaysia clinics, which had been rebranded as community clinics. Public support for One Malaysia clinics. MP Jalaluddin highlighted the significant public support for the One Malaysia clinic in Taman Bukit Kempas, with various ethnic groups expressing their appreciation for the excellent service provided by the clinic and its staff. Impact on the people. The MP underlined the potential adverse impact of closing the One Malaysia clinic, particularly on the access to health care for the residents of Jelebu. Last but not least, request an official announcement. MP Jalaluddin conclude by requesting the Honorable Minister of Health to make an official announcement in the Honorable House regarding the cancellation of the closure of the One Malaysia clinic, especially in the Jelebu Parliamentary constituency and other constituencies affected by the decision. In addition, in terms of evaluation and ranking, the performance of an MP can be evaluated based on various factors, including their ability to monitor and address issues that affect their constituent. In this case, Datuk Jalaluddin bin Alias was monitoring and advocating. Datuk Jalaluddin monitoring of the allocation for clinical support service and his advocacy for the continuation of the One Malaysia clinic in his constituency highlight his proactive approach to governance. Besides, it has an impact on the community. The MP effort to highlight the positive impact of the One Malaysia clinic on the diverse communities in his constituency, as well as his recognition of the dedicated healthcare professionals serving at the clinic. By taking the ranking of MP performance, Datuk Jalaluddin performance can be ranked as a good based on his proactive monitoring, effective advocacy and strong representation of the interests of his constituent. His detailed inquiry personal engagement with the affected community, and public acknowledgement of the healthcare professional contributions reflect a high level of commitment to his role as an MP. In the proposal for improvement on the issues raised in this parliamentary session, as an improvement, Datuk Jalaluddin bin Alias could conduct a thorough assessment of the reasons for the closure, investigate the rationale behind the decision to close the One Malaysia clinics, and determine if there are alternative solutions to address the concern raised. Besides, gather public feedback, organize town halls or public consultation to gather opinions from the people affected by the closure, especially those who rely on the clinic's service. In addition, explore alternative solutions, which is to identify and propose alternative solutions to address the issues raised, such as improving the clinic's infrastructure, staffing, or management. By taking these steps, Datuk Jalaluddin bin Alias can demonstrate his commitment to addressing the concern of his constituents and ensuring that the One Malaysia Clinic continue to serve the people effectively. In conclusion, the concern raised by Datuk Jalaluddin bin Alias reflect the potential adverse impact of the closure One Malaysia Clinic on access to healthcare service for the affected communities. The request for the Minister of Health to announce the cancellation of the closure is a plea to prioritize the well-being of the people who rely on these essential facilities. It is imperative for the Ministry of Health to address this concern transparently and ensure that alternative provisions are in place to mitigate any potential negative effects on the communities. The exemplary service provided by the dedicated medical staff further underscore the importance of retaining these clinics to support the health and well-being of the people they serve.